Hello and welcome to Dental Health Matters, brought to you by the BSDHT. Today's episode is all about first smiles and why oral health education truly belongs in the classroom. We'll be discussing the importance of reaching children early, meeting them in familiar environments, and how classroom-based education can help shape positive, lifelong oral health habits. I'm delighted to be joined by Michaela O'Neill, who's passionate about early intervention and empowering children with the knowledge and confidence to look after their oral health from a young age. So thank you for joining us, Michaela. It's a real pleasure to have you on our podcast. I wanted to start by asking if you could tell us a little bit about your own background and what led you specifically to focus on the oral health education of children, please.
I was a dental hygienist trained in London, and I worked in London for the first 7-8 years after my qualification. And part of that, I didn't see an awful lot of children, okay? If I did see kids, they were basically to do a fissure sealant on. Very little advice was given on OHI. I mean, that would be the time I would maybe try to show them how to brush their teeth, but it certainly wasn't a monetised area of oral health. And I remember going to temp in one practice just as I was winding down and ready to come home to Northern Ireland, and it was the most luxurious practice I've ever been in. Honestly, it was a paediatric practice. It had glass doors. It looked like it was in an atrium, beautiful flowers everywhere. They had 90-minute appointments for children. Okay, 90 minutes. This is like, most people were getting 15 minutes to see a child. This was 90 minutes, and you got the chance to do fluoride trays. You got the chance to do fissure sealants if they were needed. But the rest of the time was spent having fun, giving really good toothbrushing instruction and talking about teeth and, making it fun for them. And it kind of really stuck with me, especially as I was coming home to Belfast, which had a very different demographic from that kind of luxury. That really this was a luxury. That was it. It was a luxury to spend that time giving oral hygiene advice, and how unfair that was, because prevention should be the cornerstone of anything we do medically. And we don't get the chance to do that in our normal day-to-day life. Normally, things have changed a bit since then. But definitely at that stage, it wasn't a priority. So if you're talking about a little bit why working with kids in that way was important to me, is because I felt it shouldn't have been a luxury. I think it's a right. I think we were all got this right to know how we should look after our mouths properly.
Yeah, I absolutely agree with you, Michaela, and it's sad to think that we've probably gone backwards from that in many ways as well, isn't it? So that brings me on nicely to talk about first smiles, and I'd love you to introduce to the listeners and the viewers what first smiles is and why it means so much to you, and why that early intervention is so important through schemes like that.
First Smiles is about us as a profession being able to give back to our communities, and that's really important. Okay, I can't tell you how much satisfaction that gives everybody, all right, and not just ourselves, to show people what we're capable of doing and what we can do, but to the people we're actually giving this to. It's a huge bonus in their lives to have this intervention from our profession, I believe. It opens the door for people to come and visit us in practice, but it also brings up the subject of oral health in classrooms, which is a very important topic as well. For us, it definitely is. But for people's general health, as we're finding out nowadays, that this is something that carries you the whole way through your life. There's a bit of research carried out by a girl called Emma Holscombe, who is in dental public health. And I quote this because I knew her mother. But I also think it was very important. She was able to demonstrate over a longitudinal study of over like 6,500 children, the effect of good oral hygiene on a child's mouth, and from the primary dentition to the adult dentition. So if you had caries as in your primary dentition, you were much more likely to have caries in your adult teeth, meaning that actually if you didn't have any caries in your baby teeth and you looked after those well, you were a lot less likely to have that problem as an adult. Now that is really kind of compelling, isn't it, when you think about it? one of the things, big misconceptions I think we have is that, or not us in particular, but I think in general the public have, is that baby teeth don't really matter because they fall out and they get replaced by their adult teeth, and that's what you should be looking after. But it's not the case. We really need to focus on these, not just good habits, but looking after these teeth, because it will actually create and form what we're going to have as an adult. So that's one of the things I feel is really important about doing it. First Smiles itself, I think, was a way for us as a profession to get out into the public and show what we're capable of being able to do. It was a market that needed to be addressed, if I want to bring it into business terms, but like really kids don't get that chance in dental surgery. As I've just said, you know, it's not that you actually get paid a fee by the government to show somebody how to brush their teeth as a child, or if you do, it's very, very minimal, and it doesn't cover the cost of having to do it in a surgery. So being able to do that as a volunteer and spend time on it and make it fun and do it right is a huge bonus for the kids and for us as well, to be able to do it right, and the appreciation that we get from it. So yeah, First Smiles is that vehicle to do that. It was a way of us being able to send volunteers into schools to give oral hygiene advice that blends in with the curriculum in an age appropriate way, and hopefully have an effect on that market that we couldn't get to in the dental chair.
Oh, brilliant. Giving back is always so satisfying, isn't it? You know, and like you said, in your own community, you understand your community maybe a bit better than somebody outside of the community would, and you understand the demographics, and then you're also a familiar face.
Absolutely.
Outside of that environment as well, which is lovely. No, that's great. Thank you. So thinking then that this is where dental professionals could go into a classroom. Why do you think that delivering it in a classroom, like delivering oral health education in a classroom, is so important?
Well, as I said, you know, firstly, you're getting to a demographic that you don't necessarily get to in the dental chair. Okay, for a start, it's only about 50% of adults even that repeatedly go back to a dental practice on a regular basis, on a yearly basis. That's only 50%. You know, the other 50% are parents, I'm sure. I'm sure some of them are. And you'll find that if they're not having that habit of going into a practice every 6 months or every year to have a checkup, their children definitely aren't. So this gives us a chance to get at the source, to people that don't necessarily, as I said, get in to see you on a yearly basis, but also probably just don't even know the importance of what we're trying to say, and maybe have never heard it before. So it's actually it's a great way to do it. Now that's one point, is just getting to the people. The second part is actually doing it outside of this clinical environment. There's nothing more intimidating, even for an adult, than to sit in a dental chair and open their mouth and leave yourself wide open to what somebody wants to do to your mouth. That's quite a vulnerable position to be in. And I think kids feel that as well. And plus they hear the stories from their parents. You have to be good, do as you're told. If they tell you off for not brushing your teeth, they'll, you know, whatever, that's it, no more sweets. You know, all the threats that they get to go into dental practice can't make it somewhere that they don't really want to be. So yeah, in my opinion, this is a much more chilled, relaxed area to be. You're in school, you're with your friends, you've got your teacher, you know, the surroundings, and if they're lucky, they'll have people coming in with huge big puppets and make it fun and, you know, engaging as well. So yeah, definitely the best place to do it in the classroom.
Yeah, you've sort of led on to my next question about how children respond better when it's in a more familiar environment like that. And also the fun element of it, like you say, taking it out of that clinical environment, which actually some of them have never had the opportunity to go into a clinical environment anyway, have they? So how do you think we should sort of be able to start these early conversations about oral health? Or how early, I should say, do you think we should start these conversations? Because intervention, we know, can lead to lifelong habits.
See, I was going to say, I don't know about you, but when I was training, we used to go into the maternity wards and speak to, you know, parents, mothers and fathers to be when they were doing their courses before, the prenatal courses, to talk to them about their dental health during pregnancy, but also then what to expect with their children and how to look after their teeth and whatever. So great place to start that message, I think. But obviously, and we've always been told, you know, from first tooth, you make sure that you start brushing teeth. It's never too early to start talking about teeth and making it important and part of a routine. It just has to be part of a routine.
And I know that health visitors are expected to discuss it with parents as well when the baby's born. So we've seen it in bed more. I didn't get to go to maternity wards when I was training. I think that's a fabulous idea. But then working within a cleft lip and palate team, as I have for many years, that we know that there is going to be a baby born with a cleft, therefore they'll be more high risk for other dental issues. So we have often had the opportunity to talk to prospective parents, but that isn't widespread, is it? This is perhaps where we're dealing with that inequality, and that maybe it is never too early. So how do you think, we've talked about classrooms, how do you think that addresses inequalities? Because we know there are many oral health inequalities in our 4 nations, with access, with financial issues, but how would you explain the benefit of being in a classroom and how it addresses oral health inequalities?
Everybody has to go to school, really, don't they? The majority of people, there are very few homeschool people. So we are definitely capturing you regardless of what the area you come from is. You're all being captured. And you're given the same platform as everybody else. So for me, that is an equal playing field when you talk about schools, because they have everybody in their school, regardless. But there are a lot of health inequalities. There are areas, I know myself, that even though I might come from quite I wouldn't say it was Athlone, but I would say that quite, we have areas and pockets of people here that wouldn't go to the dental surgery regularly, but will go to school. So we know that we can get them in the right place in the right time, or we're more likely to get them. I was going to bring in as well about the fact that different cultures have different ideas about, how important your baby teeth are, and that, depending on where you're from, you could think that it doesn't matter what we do to these teeth because the second teeth are coming through, and that's what we'll have for our life. So these are just like, I don't know, practice teeth. You can eat and drink what you want. And I have actually seen that when I've done first smiles myself, and I've gone into a classroom to talk, and I can see certain children that aren't particularly, will have a lot of caries around their front teeth, would have used a bottle and with juice in it, and you can tell from looking at them. And this is at 6 and 7 years old, their teeth have rotted down to stumps, and they're now having to get them out. So I think that really, yes, classroom is a brilliant place to do this. Anything we can do to hit those numbers, to stop those hospitalizations for children like that to have to go in and get a GA to have their teeth taken out, the better.
Yeah, it still is the most common reason for childhood admissions to a hospital. It is a general anaesthetic.
People know they need to brush their teeth twice a day. And actually, let's be fair, people know they shouldn't smoke or they're drinking too much. But those health messages can be out there, but actually having them implemented is a different thing. So how we get the message there, how we show and tell and do when we're in the classroom makes a huge difference. Okay, so you might know that you need to brush your teeth twice a day, but this is how you do it properly, and this is really why you do it, and this is, let's feel it, let's try it, let's do it, and repeating those messages again and again, hopefully we'll be able to in the end have some kind of change.
Yeah, and also knowing that your peers, the other children around you, were told the same thing at the same time and had the same fun. Actually, it becomes more normal then, doesn't it? You think, well, if everyone's being told, I should be doing it as well.
In First Smiles, you get a brush. Because again, you're talking about, when you said about the disparity that you could have in the classroom from different walks of life or areas of deprivation, there mightn't be toothbrushes at home, and that isn't uncommon, okay? And that's what's sad. It's not uncommon in this day and age. You can have an iPhone, you might necessarily have a toothbrush. So I feel that the fact they're going home with the toothbrush, their very own toothbrush, which some people might be their first ever very own toothbrush, that they'll be able to take it home and use it and know that their friends have got one exactly the same and they're no different from anybody else in their class in that aspect.
I know there will be some listeners and some viewers that will find that hard to imagine, but you and I, from the backgrounds, the professional backgrounds that we have, I definitely treat families that share a toothbrush or are still using the one I gave them the last time they came for an appointment. So it is a sad reality, but actually something we're doing positively to help. And I'm just thinking now of anyone who is listening or watching who really wants to get involved, wants more of a role in supporting schools and with oral health education-led initiatives. What can they do? What should they look up now and start thinking about?
Well, we will be advertising our first smiles now. I believe it's kind of open, so that the programme is ready for you to apply. If you've got a school you would like to go to, even better, you let us know and we'll arrange with them so that you can come in and talk. Obviously there's paperwork and permissions that need to be completed beforehand, Rhiannon, isn't that right? But you will get, if you can tell us how many children you've got and what age group they are, then we can actually provide you with the brushes and some materials as well, resources that will really help them, like brushing charts or stars and stuff. So that's open to apply for now to do. I think one of the biggest ones I remember happening was the headmistress who phoned up one time, BSDHT, and phoned them and said, can you come and help us? We have so many children missing class in school because of toothache. I would really love to do a full day with the whole primary school if we could, teach them all how to brush their teeth and the importance of oral health. And we did have volunteers that went into that school. I don't know if you remember it. It's like 1,200 students. And they went into the school and they had a Toothy Tuesday and had a brilliant day. They split them into lots of different groups and they were able to see all the classes. And the headmistress was absolutely blown away by the difference it had made in her school. How people were all talking about oral health, how they brush their teeth. It became a normal thing. It was part of what everybody was doing in that school. So yeah. Definitely. So you could be a headmistress, you could be a teacher, you could be somebody who actually teaches that part of the curriculum in your school, where you have to teach how children have to look after themselves. It's embedded in the Key Stage 1. Anyway, it could be that, and you think, well, it would be great to have somebody in who actually knows how to talk to children about this topic and who could make it exciting and different. And you could actually phone up BSDHT as well, and I'm sure Rhiannon can supply the phone numbers that you'd need to contact and the email addresses so that you could get yourselves sorted out or hooked up with somebody who is actually a dental hygienist in your area who wants to volunteer to help. So that might be a bonus for your school. But yeah, I think it's an easy thing to do. It's wonderful to give back. I keep saying that, I keep remembering Phoebe on Friends talking about how there's never a good deed, never a sacrifice you can make that doesn't give you a benefit back as well. And unfortunately it's true. So you could be sacrificing and volunteering your time, but you will feel really good about what you've done afterwards because you've helped somebody.
It's so true though, isn't it? And I think there might be people who would love to do it, but they've never done it before. And you don't have to do it on your own. That's the other thing. There might be someone in your region or in your area who wants to do it with you. Maybe they've done it before and they'd happy to have you shadow. Or maybe both of you have never done it before. But that's the other option. It doesn't have to just be you. So if you visit the BSDHT website, you'll see the section on there. It runs every year. You have a time frame to sort of to do it in as well. It doesn't have to be a specific day. There's a little bit of wriggle room there. So, and we love to hear. I mean, that's one of my favourite things, Michaela, afterwards is reading the stories that come in from the members who've done it, seeing the photographs, because Key Stage 1 always have fun. That is it. You have an absolutely captive audience when you go in and all those little children are sat on the mats. It's got to be one of the nicest parts of our job, hasn't it? Definitely. Thank you for that. And visit the website definitely for all the information. Or pick up the phone, as you say, if you want a little bit more information, because we might be able to match you up with someone in your area that you could shadow if you wanted to. I'd be happy to do that in South Wales for anybody.
It's a really nice idea to do it with somebody else, particularly if you're looking at a class of 30 people, which can happen a lot in primary school, so that you've got a chance to maybe do a little bit more one-on-one, because anything that you can do hands-on with will make such a bigger impact, as you know yourselves, obviously from being in practice, but that would help an awful lot to have somebody else there with you. It's a nice idea, Rhiannon. I like that one.
And also, because of the government bringing in the toothbrushing in schools, they're less squeamish and less bothered about the idea of children using a toothbrush in the classroom now. I think years ago when I used to do it, I had to show them on a model, and it's not, we love this touch to teach, you really got to get in there and show them, but it was always difficult. One of the good things of the supervised toothbrushing is the schools are a little bit more familiar with it now. They do understand that is the best way of showing a child, and Great. Maybe not with toothpaste, though. That could go horribly wrong. My next question is about misconceptions. And you've actually highlighted one already about belief that baby teeth are expendable, that it doesn't matter because you get a second set. And that's definitely a common misconception I've come across. But what other misconceptions have you come across over the years of running First Smiles as well that you regularly encounter, and working as a clinician as well?
Obviously, the big one is, that these are the expendable teeth, and they're not. The next one, I think, would also be that, what good does one visit do? For me, it's a matter of a consistent, repeated message all the time. And some people aren't getting that message at all, okay? So this will be their first time getting it, but they're getting it in a school classroom facility, which will be reinforced by the fact that the rest of the class are having the same message. So as you're not there every day, the rest of the class might still be talking about, did you brush your teeth this morning? What about the resources we left with the brushing chart? How is everybody getting on with their brushing chart? Maybe they're left in school, so everybody puts their sticker up. So this message is repeated and repeated and repeated so that we can get some behaviour change. So I would never, ever say that just because you've gone once to that class that it's not going to be effective. I totally disagree. I think every little thing that we can do in any small way will make it effective. And I can't reinforce it enough that people actually try it, do it, and do what we can to kind of give them this little bit of luxury that they wouldn't get ordinarily.
And do you think, this is a little bit of personal opinion, I suppose, but I've done a bit of research into the area. There are some great dental charities out there, and people go abroad to help, which is admirable. But it doesn't feel like the dental profession does as much as it could to give back. It's not difficult for us to go into a school, particularly Key Stage 1, where it's fairly sort of basic level of brushing and things like that. Actually, this is something we should be encouraging, and thank you for bringing something like First Smiles and partnering with us, because actually once you've done it, we tend to find people do it every year. It doesn't feel like a one-off. They build a relationship with that school to the point where they ask, are you coming back this year? What date will you come? And local nurseries find out about it. And it's a great practice builder, because they'll also know that you work locally, and they'll trust maybe you a little more, knowing that you give back to the community. So I have to thank you for that.
A lot of people in the dental profession do give back, okay, but maybe not in a unit like we're doing this programme. So it'll be one-off, and you'll not get as much notice taken of maybe a smaller group. But this is quite an impactful programme, in that we see over 5,000 people every time we do this, which is usually the date we use is the last Friday in National Smile Month. But it goes for the whole of National Smile Month. So we see about 5,000 students or pupils that would never get that ordinarily. Okay, so I feel that can impact it. Plus, we will have media around it, so we're able to show people what we're doing, and that gets more people, I was going to say enticed, maybe that's not the right word, but maybe attracts more people into doing this as well, because they know that this is something that can be done. But I think it's a very valuable part of our life as a professional, to actually give back to the community how and when we can. So yeah, I really do think that it's...
And the security of knowing it's a well-organised and well-run scheme as well, that other people have run that, because a lot, we look for that strength of evidence now, don't we, as well, and for support.
Yeah, and you have the support of everybody that's in that group, even if it's about, okay, we actually do have programmes as well, like how can I talk to this group, this age group? Well, here, we've got some advice here on this site, and we've got a nice buddy program you can use here, and so we've got a lot of materials with the SDHT that you can use to help you form a good talk that's actually going to make it interactive. It's going to engage your audience.
And yeah, I take no convincing. I absolutely love talking to Key Stage 1. Key Stage 3 become a little bit more tricky. That can be another podcast. Okay. So I'm thinking now, finally, what changes would you like to see in the future of oral health education, and also what's next for First Smiles? Is there something new that you're thinking about in the future that you're able to share with us?
First Smiles will sit with BSDHT. It'll always be their programme. And yes, I know that that was one that I helped develop whenever I was president. So it's something that's close to my heart, obviously. And in my work now, I'm lucky enough to be able to support it from another avenue. So that's where it all loops back in again. When I look at what I want to see for oral health, I would like to see this not to be a luxury. I would like prevention not to be a luxury, okay? I would like it to be something that is everybody's God-given right to be able to know how to prevent disease in their mouth, in their general health as well. I think the First Smiles has definitely got legs when it comes to getting to people of all age groups, of all demographics, of all socioeconomic status. I would just love to have an even playing field for everybody, so everybody gets the same in that aspect. There could be developments in the First Smiles with BSDHT. There could be something that we need to look at, maybe expanding the program. It could be that we look at how we do this. Some of the messages definitely could be updated. I know we talk about giving manual toothbrushes out, and again, that comes down to the fact that when it comes to the financial aspect of it, that is probably within budget to do. But wouldn't it be great if we got to the stage where everybody could have an electric toothbrush and we'd know that the cleaning was so much better, it was being done properly. I mean, we don't go back to using a broom for the floor when we've got a vacuum. So I do think that that would be ideal. And maybe one day we'll get there. Maybe we'll get to that stage where we can actually give everybody the luxury of that as well. But in the meantime, we'll definitely be running it this June.
Yeah, absolutely. And I hope this encourages people to think a little bit more about what they can do in so many ways, not just in their local community, but how being a member of an organisation that you have been president of, I'm currently president of, that's when you see the traction that you can get, and how you can sort of speak to people in places where actually there is a bit of power and there is a chance to change things as well. So no, we will use that position to help, like you say, and make it fair and equitable for everybody. So thank you so much for your time, Michaela, today. It's been great to chat about it, and I can't wait. Well, usually the edition of Dental Health that comes out after, so our journal that comes out after First Smiles is great. Seeing all the photographs and reading all the great stories in there.
Seeing all the various states of dress as well. There's so many people dress up. It's just it's lovely. It's so lovely. It's warming.
That brings us to the end of today's episode of Dental Health Matters. Thank you so much for listening. We hope you found today's conversation helpful and informative. If you enjoyed this episode, please remember to subscribe, leave a review, or share with someone you know might benefit. See you next time.